Hi, everybody. It's Dr. Laura with Connect My Brain. Thanks so much for tuning in. And boy, do I have a treat for you. I am so excited. I've told you this many times that I would get Dr. Zelinsky from Chicago on the podcast to give us some great information about why it is so important that we're looking at our children's eyes, not just our kids. I even have my glasses from her as well. But she's got such a great way of putting visual, auditory, and vestibular together. And as my audience knows, you know how much I love those three systems. So without further ado, welcome Dr. Zelinsky to the podcast.
Thank you, Laura. It's nice to be here.
We're so glad to have you here. Okay, so we're just going to jump in because I want the audience to hear you and to hear your background, how you came to bring these pieces together, and tell us just how does this work with glasses to put these three systems together?
Well, that's a good question. I have a math background. I come from a mathematical family, and when I went to optometry school, we learned about how glasses magnify and minify depending on how you put the lenses in. And I started thinking about and learning from mentors who had been older than I was, how the magnification and minification changed the way people perceive things in the space around them. So if you magnify on one side more than the other, people are going to perceive things as skewed a little bit, one way or the other. And when they perceive things as being skewed, then their posture shifts. And so I started working with the posture shifts and glasses, which would be linking vestibular with visual. Which I'm sure you're very well versed in that. But then in 1992, I was working with a friend of mine and found by accident that when I put glasses on that angled light to shift people, that her perception of sound also shifted in the same way the glasses pushed the light through a closed eyelid. So from 1992 till about 2000, so about 8 years, I was doing that with my patients. And I was saying, which is better, one or two? And they would say, I don't know. They look kind of the same. And then I would try a sound localization experiment. I would ring a bell and have them try to figure out where the bell was with their eyes closed. And they were perfectly accurate with one choice of lenses. And then they were not accurate with the other choice. Sometimes it was a big difference. And so I thought, okay, you don't see a difference, so I'll prescribe you the lens that makes you hear the best. And I would have patients coming back saying, wow, these are the best glasses I've ever had. I've never had glasses that made me feel so comfortable. So I started at that time just prescribing based on what made people see and hear, and their spatial perception was linked together. And so thus we're linking the auditory and the visual and the vestibular. Then later, I started working with changing posture and seeing how the posture changes also affected where people heard things. And Svetlana Moskitova works on that often, showing how if your head position is rotated one way or the other, your ears are shifting position, and therefore you're perceiving sounds in a different location. So sometimes children who rotate their heads, they're doing that to listen better. And sometimes children who slouch in their chairs, they're able to find my bell easily, but when they're told to sit up straight, then they can't find the bell anymore. And so we're like, why, if you slouch, why would you find the bell better than if you're sitting straight? But then when I put glasses on that make it so when they slouch, they cannot find the bell, and when they sit up straight, they can find the bell, that's easier. So by about 2000, the year 2000, I was busy talking to people saying, wow, every single patient I have is changing when I put glasses on them. Their listening ability is different. And I was told there's no scientific proof that shows this, so it must be a fluke. And I said, but it's like magnets. When you have two magnets and you push them together and they link, and then you rotate them, turn them upside down, and then they repel, and you turn them and they link, and you rotate them and they repel. You can't see anything between the magnets, but you can feel some sort of force. And years later, somebody said, "Oh, there's electrons in there." So I truly feel that something in the processing of the brain is linking the auditory and visual space, but we haven't yet found it. There is a new cell that was discovered in 2021 called the campana cell, and it's in the retina, and it's the whole thickness of the retina. Nobody knows what it's for, so perhaps that's the one. They couldn't see it for the last 150 years because microscopes can't see it. It's too small, and they needed nanoscopes, real tiny. But that's how all of this started. I went to Europe in the early 2000s and started teaching optometrists all around, and every one of their patients had the same thing happen. So it was thousands of people over many different countries for decades that were having this reaction. And then finally, by 2014, I put together all of the auditory visual linkages information I could find, and the phenomenon, like the McGurk phenomenon from 1976, and put it together in an article talking about auditory visual integration and how it was helpful in brain injury. And now it's 2024, it's 10 years later, and tons of scientific literature is out showing how auditory space and visual space are linked. There's an Italian researcher named Monica Gori, and she's been working with blind children, showing how their auditory space develops differently than a non-blind child. There's Dr. Wallace, who's at Vanderbilt, Mark Wallace, and he found in autistic children, or any children on the spectrum, their auditory and visual senses were not linking. That they were hearing things out of sync with what they were seeing. And so more and more research is showing what we're doing at the Mind Eye Institute. And the bottom line of it is that when you have a regular eye exam, they put in an instrument in front of your eyes that blocks off the side. You're looking straight through a little hole. Usually they cover one eye up and they say, look through the little hole, read a letter that's not moving on a chart. That's testing your central eyesight straight ahead, which is about, as Patrick Quaid's research showed, about 6% of the overall that you're aware of.
Wow.
So you walk around, there's 94% of the environment that pours in that's blocked off when you're testing at a regular eye exam.
Wow. Okay.
And so typical eyeglasses are prescribed for that 6%, and that was developed way back in the 1800s, and it's still more than adequate today for somebody who's an average person, a neurotypical person. But the other 94%, that's the important part for all of our patients that are on the spectrum, that have genetic disorders, that are labeled on with learning problems, that have any sort of brain injuries. It's the 94% surrounding, which is processed faster by the brain. That's the important part. So our prescriptions at the Mind Eye Institute are designed through our patented protocols to prescribe for the 94%, not so much for the slower 6%.
Wow, that is just fascinating. There's so many pieces. I really did not know about you and how you put all this together. That is just wonderful because I know over here at Connect My Brain, we love too the visual system, the auditory system, the vestibular system. But obviously, I'm not a doctor of optometry. But last year, I was looking to find something and I came across Mind Eye Institute. And one of my families, I told them about it, and before you know it, they were scheduled and on their way. And the change that we saw in this little girl was absolutely amazing. And I love that you appreciated too how we do brain mapping here. And you encouraged me to, once they get those glasses, do another map and look at the changes. And I mean, instantaneously, there's changes in the maps. And so it's now become part of how I talk to every parent that comes and asks me about Connect My Brain. At some point, we're talking about that eye piece
Mhm.
because this particular little girl, when I met her, it just broke my heart. She's only 8 years old and she's telling me how she hates school.
Mhm.
And I mean, you're talking, you got like a whole lifetime ahead of you to go to school and to hate it already. And now she's already gone through our program. I think she's been back up for a reassessment once or twice. Um, and remarkably too, the school that she was going to previously, they're not really supposed to be diagnosing, but they literally said, "Oh, she's not ADD anymore." And that was like, and that's one of those private schools that cost about 40 grand to go to per
Mhm.
year. And to have that comment come back, it really opened my eyes. And I love looking at eye movement. And like, I have so many kids that the school just wants to put them on medication.
Mhm.
They think everything that's going on with them is attention deficit and they just need medication.
Mhm.
And that's why we have sent so many kids to you, because we had enough data to
Mhm.
go, they can't see properly. If they can't see properly, how in the world do they pay attention?
Mhm.
What can, attention is one of those really big issues. Can you speak to that? Why is it that we do have so much of that going on in our school systems? And really, a lot of it is about how their eyes are functioning.
Mhm. Well, again, as an optometrist, you would think me as an eye doctor, but when you start realizing that the retina is an actual piece of the brain, it's an extension of brain tissue, and the retina has spots on it like a patchwork quilt where different spots link with different spots in the brain. So we're doing brain mapping every day also through the retina. We're doing retinal mapping.
Wow.
And there's research studies with autism and attention problems showing that the peripheral retina, that 94%, is hyperactive in attention deficit children, and it's hypoactive in autistic children.
Wow.
So that's where the key is. It's a missing link. And people assume if you take medication and you change the inside of the body, change the chemistry, that then people can place attention better. But they're not always realizing that the outside, the way that the information comes in, is critical. So the example I often use with patients is wild animals. If I have wild animals that are racing at my window and banging on the window trying to get in, it's going to scare me and raise my blood pressure. And if I go to the doctor and they say, "Oh, your blood pressure's high, let me give you medicine that'll calm it down," then great, the medicine works. But then I go back and those animals are still trying to get in the window, still scaring me. My blood pressure still goes up because I can't get out of fight or flight mode because my peripheral eyesight keeps seeing the animals moving toward the window and my peripheral auditory keeps hearing them growling. So if you get rid of the external problem, otherwise you could go to the doctor and they could just keep giving you more and more and more medicine. But if you get rid of the problem and get rid of the animals and they're gone, so you don't have the sounds anymore or the sights, the blood pressure goes back to normal. You get out of fight or flight mode. So for patients with attention problems, it's the similar thing. Everything that moves around them catches peripheral attention, and then it shifts their attention to something else. And it's very hard to maintain when you're not tuning out the background. And people with attention deficit disorder haven't learned well enough how to tune out the background.
Now, what about with the autistic population? If they're hypo,
Mm-hmm.
what is it that they're perceiving?
They're also, as I said earlier, their eyes and ears are a little out of sync with each other, and
Mm.
they are perceiving a tunnel, like a straight ahead. I want a cookie. I see it there. Boom, I'm going for it. Um, but they're not aware of social cues because that would require watching body language of other people, watching facial expressions of other people. They're not listening to the tone of voice and the content of the voice. And some of them, you have a right and a left of each of those 4 items. So there's 8 different sensory channels that are pouring into an autistic child. The auditory, the visual, each have a peripheral and a central, and then each of them has a right and a left. So 8 channels pouring in, and they're all out of sync with each other. It'd be like trying to watch a television show on 8 different TV screens, where one has just the sounds, and one has just the sights, and one has just the central details, and one just the peripheral. It'd be exhausting to try to piece them together and figure out what's going on. You would end up with the gist of what's going on, but not the details. And that's what a lot of these kids do at school or in life. They get the gist, oh, mom's mad at me, or oh, dad wants me to build this, but they don't hear the details. So you say, go to your room, put on your pajamas, brush your teeth. That's 3 pieces of information, and sometimes their brain can't take it all in, and they don't see it as one thing, get ready for bed. They see it as 3 separate things. So when they're hearing their parents with, when 10 separate things, then boy, my parents make me do so much, when really it's just go in your room, brush your teeth. The parents are looking at it as one giant thing, and the child's looking at it as 10 separate things, and it's hard.
Yeah.
So
What a
what we do,
great explanation. That's a really good explanation.
we have that with
Wow.
reading and writing too.
Sure, go ahead.
Sometimes with writing, the teacher will say, write 2 sentences, and then you can go to play. And the child will be, okay, boom. And other children will say, wait a minute, that's like 20 words. And another person might say, that's like 100 letters. And someone else might say, that's like 200 strokes of my pencil. And, wow, look at what this teacher's making me do. 200 strokes of my pencil before I can go outside and play. What a mean teacher. When the teacher's thinking is only 2 sentences. Make up an idea, write it down, and you're done. And so the processing of how a child thinks in their head, their internal visualization of processing space and time, is so critical. So at the Mind Eye Institute, we put glasses on to wake up that 94% or tone it down. That's from the outside. So we get rid of the animals, everything from the outside. But then there's the second part of the internal visualization, all the visual skills that have to be built up. So we find where's the weak ones and how do we build them. And we try to find games and fun things.
That is just so great. You and I both have a appreciation for primitive reflexes.
Yes.
How does this play a part in your approach and how you put these glasses together and how you came to this?
Well, my mentor, Albert Sutton, taught me about 5 primitive reflexes that are linked with eyes.
Hmm.
The Moro reflex, the TLR, tonic labyrinth reflex, the spinal galant, the ATNR, and the STNR, the symmetrical tonic neck reflex. So those 5 are linked with your visual function. 3 of them deal with your neck position, your chin up or down. And you can tell that, like the TLR, for instance, the tonic labyrinth reflex, when children are walking on a bridge or slats and they look down, it gets scary for them and frightening. That's the TLR. The peripheral eyesight is very much linked with neck position. So if the neck position has reflexes that haven't integrated, then the peripheral eyesight is not working efficiently. The spinal galant is more of the how the lower back and the upper back link together, and that's linked with the head. Like if my head goes up, then my back goes up, and then I lean back. So you have the head versus the neck, how the head is dealing with the upper body. Then you have how the upper body is dealing with the lower body. So the spinal galant is the link between upper and lower body, and all the neck reflexes are the head with respect to the upper torso. And then the Moro reflex, which is a startle reflex, that's linked more with right side, left side, and top and bottom. So, but it's more bilaterality. And that's found, brand new babies startle. And after a brain injury, people still startle like that. And as I broke my back a couple of years ago, and now in the winter here in Chicago, when there's so much ice on the ground. I'm like these 100-year-old people with both arms are up. If you put a whole row of 100-year-old people walking on ice, they all put their arms up like this, kind of like a Moro reflex, and you don't tell them to do that, they just do, because
High
that's
guard.
survival
Yeah.
reflex. You have to do this in order to make sure you stay balanced. So
Wow. There's just so many pieces to this, and I'm so interested in a healthcare system, regardless of what entity that we're talking about, that we really begin to appreciate the intricacies of how this nervous system actually works. It's not part and parcel. It's like an orchestra.
mhm,
And when you put it all together and you support these people, that they go in such a better direction.
mhm,
I know because like I got my glasses from you. I was really concerned for myself getting progressive lenses. I was so afraid that it would be hard for me to adjust to it. It was nothing.
mhm,
But I think it's because of your approach, because I've
mhm,
I've looked through those before,
mhm,
and I was like, no, no, I don't want those. And I put these on the first time
mhm,
and I was fine. And so that was really exciting. And I got to tell you, since I've had mine,
mhm,
I feel like my brain is better.
mhm,
And then I brought my daughter to you, and she had a traumatic brain injury, and we'd done lots of work, but there was a lot of anxiety that was still carried over, and she lost hearing in her right ear. We got it back after about a year. We used the integrative listening system, but I had no idea about, can she find sound?
mhm,
And I remember that day sitting in your office, and you had her eyes covered, and we tested the left and that was fine. You go to test the right, she couldn't find anything. And I was like, whoa. And then we got, her glasses, and the change in her, for now, I guess for about a year and 2 months in, but it's remarkable how her brain has changed. And this has been like a polish.
mhm,
And this was 8 years later,
mhm.
so what could we add into our discussion about traumatic brain injury? What could we share with the audience for that?
Well, first of all, when you're mentioning that, I thank you for what you're saying. We see that type of change in people all the time.
That's
Uh,
great.
and as far as your progressive lenses go, the way we prescribe for the 94%, that's the part that people uh, need in order to walk around with progressive. It's called a navigation system as opposed to an identification system. So
Okay.
if you sharpen the eyesight to see clearly on a non-moving target like a letter, but then you say, here's your glasses, now go walk around with them. And the original testing was done only sitting in a chair, so your hips weren't moving. Then you might not be able to adapt to them, or it might take a week or two to adapt.
Mm.
But we also, when you came, did moving targets. We had you walking, and then we measured for startle reflexes when we angled light different directions. So we had a slew of information on all your visual systems, because there's a lot of them, how they work together to prescribe the lenses. So to answer your question of what we can do for people who have brain injury, um, we can work with them listing all the different nervous systems. It's not just one nervous system. The fight or flight is one, that's on the inside. You also have a rest and digest one, which is the opposite of it, also on the inside. But your internal sensors, like your head position, vestibular, or where your muscles are located, those are proprioceptive inputs. All of those internal sensors send signals to your brain, to the central nervous system, to make a decision. And the central nervous system consists of, in the textbooks, the brain and the spinal cord, but now it's um, unrefuted that the retina is an extension of the brain. So it's really the retina and the brain and the spinal cord together that makes your central nervous system. That's the decision maker. So rather than have just the internal signals getting to the central nervous system to make a decision, from the outside, we can change with glasses what's going in. And so when you change the input coming in, you're changing brain activity directly, then the decisions on how the space around you is modified.
Well,
Did that answer your question?
yes. Anything else though, like that anxiety piece?
Mhm.
I think that that was, and I think that is what you're saying. But just to kind of maybe hone in on it for the audience, that when you're stuck in that fight or flight
Mhm.
because you're not getting symmetrical sensory input,
Mhm.
that can also be a contributor to anxiety. Is
Mhm.
that correct?
That is correct. Well, there's three different. Well, there's more than three, but just for simplification, you could think of three different brains. The thinking brain, the central nervous system making a decision, that's the highest level, and there's many areas to that. But before the thinking brain gets anything, the emotional brain takes over,
Mm.
and the emotional brain will flavor what the thinking brain does as a decision. So, the phone rings and the caller ID says it's a spam caller, and you're like, my eyes tell me it's a spam caller. I don't want to deal with that. Hang up. And and then you get irritated and agitated. But then, the caller ID calls up and says, oh, here's a doctor's office telling you, whether you have cancer or not, and that then your brain goes into, oh my goodness, what's that? And then you get more anxious. But if the caller ID goes off and you see, your closest friend who you haven't talked to in a while, your whole body can relax and go, I can't wait to pick up the phone. So the decision depends on what your emotional brain does, what your experiences have shown. And so the emotional brain is governing the thinking brain. And in a lot of children that have had, the failures, or the teachers get mad at them, or they try their very hardest and they still get bad grades, or they try real hard to read and they can't read because the letters don't make any sense, or the people with dyscalculia, where they aren't able to do math problems, they get so frustrated because they're smart but they can't keep up with other people. Um,
Yeah.
those children have an emotional brain that needs to be made to feel good, to give self-esteem to, before the thinking brain can take over. And then below that, then you have your reflex brain, which is where you're
Mhm.
talking about the primitive reflexes and other things, digestion too. And
Mhm.
the digestion in many kids with the leaky gut syndrome, that can be a factor. So when the reflex brain on the bottom is not doing well, then it is influencing the emotional brain, how much information you can take in at once, how much tolerance you can push through, and then that's affecting the thinking brain.
Wow, beautiful. I love the way that you explained that. That is really, really helpful
Mhm.
because, I think unfortunately, if something is going on with a child,
Mhm.
you get the feedback from the teacher, and then there's pushes to go in a particular way. There's a healthcare system that stays in such a more traditional model rather than all of this great information that's out there. And there's so many wonderful tools. I think it's just so important, like doing this podcast. I mean, one of the reasons I love doing this podcast is because I love to teach.
Mhm.
And when COVID came and it disrupted all of the conferences that I was supposed to go teach at, I was like, I've got to find another platform. And I had my own little podcast that I was managing at the time, very, very different than today. And now I have a podcast manager. Marcy, you're great. But it's a great way to get people to hear another side, to hear another perspective, and ultimately we're bringing hope where maybe they didn't think hope existed. And there are so many different kids just in my little practice. And I'm sure that Dr. Zelinsky has lots of people like me sending to him. But I've got kids with genetic disorders.
Mhm.
I've got kids that have had trauma, injury. I have a kid that has CP. I have kids that have all been labeled either ADD or dyslexia or any of the numerous labels that are out there. And every single one of them have come to see you. And the insight that you have provided, you have opened a door. One little person, I know we can't get into the full details, but one little person here with a genetic disorder, when I did his map, there was like such disruption in the back of the brain where the visual cortex is.
Mhm.
And then looking at him physically, you could see he can't see.
Mhm.
And we sent him right up to you. And what you gave us back was so valuable. Like he's seeing through a straw.
Mhm.
And he is, I mean, it blew me away though. He's been on this planet for 4.5 years
Mhm.
with a genetic disorder, and nobody has even thought to look at how well he sees or not.
Mhm.
And just like you've already mentioned, the primitive reflexes that influence vision. So now we're down in that lower brain. If those aren't integrated, that's coming up to his emotional brain. And I can see that even in the office, and it's going to impact how
Mhm.
his higher brain is actually going to come online.
Yeah.
And so, really good news. We were able, he's leaving those glasses on. He's left them on for like 20 minutes at a time.
Mhm.
So that is really encouraging. And I feel really fortunate to have met you. And the what you have to offer is just so phenomenal. Tell us a little bit more about Mind Eye Institute. How do people, how do they connect with your facility? And what do they need to do first in order to see if it's a great place for them?
Okay. I will. I will tell you that. But beforehand, the 4.5-year-old, the question you're saying is, how could they be on this planet and not have anyone check their eyesight? Somebody probably did check their eyesight, and through that drinking straw,
Oh,
they
that's
saw
okay.
20/20. Because the goal of a regular eye exam is, can you see the letters? And the answer for that kid is absolutely. You ask me to look, I can see them. I put that little straw right there. So they're going to pass an eye exam. And then you say, well, what about the other 94%? He has it. He's just not using it.
Yes.
So it's
Wow.
like I have two hands, but if I'm left-handed and I use my left hand for everything, but I don't choose to use my right hand, doesn't mean I don't have it. So if you go to a hand doctor, they're like, yeah. So the quick example I use for that, and then I'll answer your question, is juggling, because I'm a juggler. And if I put you into a room full of jugglers and everybody's juggling and you can't, this is like a child going into a classroom where everybody's reading and you can't, then you go to the doctor because your parents says, well, you got to go to the doctor, something's wrong. And they say, no, you've got two hands, you've got two lungs, you've got two eyes, you have everything the people in the juggling room have. Go back and juggle. So the children are put into a classroom, but nobody's testing, do their eyes and their ears connect with each other? Can they listen and watch the teacher at the same time?
Mm.
And a lot of them can't. They can listen to the teacher or watch the teacher or switch back and forth real quickly, but they don't get the full extent, and it drains their energy. So you need a
Yes.
whole bunch of motivation for them to even want to do that.
Yes.
So
Yes.
it's just it's horrible to watch so many really smart children. And again, before I get to your how do you find mind eye and what do we do,
Sure.
I just want to go over one 9-year old we had yesterday who is a really smart kid, and she can't read. So they've labeled her with dyslexia, and because there's nothing wrong with her intellect. But what I found is that she was so good with pictures. I asked children to make up a story, and I listened to the innovation. So she made up this incredible story and an image of a man who was half man and half wolf, or fox. I think she made him a fox. And she had him with one hand had a paw and one hand had a human hand. And
Mm.
the nose was that of a fox, but the face was like she had this entire story in her head that's just came out like just made up on the spot. Really innovative. So we drew pictures of her story, and she was fine with the pictures. She could create the pictures herself. Then when you added a word like fox on the one, then she went into meltdown behavior because now you're giving her letters and she can't deal with letters.
Wow.
And it was when we got to one word at a time, she just melted down. Then you get the, when are we going to get out of here? When are we going to eat? But when I went back to pictures, she was fine. She would have sat with me for another hour. And then we
Wow.
started playing ball. And she could catch so much better than most 9-year-olds. And I mean, way better. She could throw and catch. So her judgment of space on the periphery with a moving target was fantastic. So her inside imagination was superb. Her judgment when she caught a ball for peripheral was phenomenal for her age. And yet she can't read a letter to save her life, you know, and to read even a 3-letter word. So something like the word the is impossible because the is like, and she gives up. And so what we're starting with for her is starting with where she's good, which is pictures, slowly, and then we're working to have her recognize letters through a tactile input, through back tracing, but not giving her letters in the front in a paper because it's too hard.
Too much. Yeah.
So so we have to take each child from where they are. So to answer your question, we're at mindeye.com. So mindeye.com. That's our website. There's a brain quiz that you could take. If you write to info@mindeye.com, then somebody can write you back. We have patient advocates that can call you and discuss your child's specific needs, and we can tell you whether we would be a fit from that view or not. We don't bring eyesight back. Like we've had people call and say, you know, my child has optic nerve atrophy and the optic nerve is shot. There's no optic nerve. So we can still do some things for visualization internally, but we don't want to set somebody's hopes up that if you come here miraculously, a damaged optic nerve will be miraculously fixed. It doesn't. We don't fix anything. We don't heal anything. What we do is we can teach you how to build new brain pathways.
Mm.
So if you have some pathways that aren't functioning well or that have been damaged or never developed, we can teach you how to develop them. But like we have one child, he needs to learn how to skip. This was just this morning's question, so it's on my mind. And we called the mother to say, how's the skipping coming along? And the mother said, he doesn't like it, so we're not doing it.
Yeah.
And
Isn't
you know,
that the classic?
but it's like this is a skill he needs to do. So then you go and you say, well, how long are you making him do it for? And she says, oh, well, we try to do this, 10 to 15 minutes a day. Well, he can't skip. So 10 minutes is way too long because that seems like forever to a little kid. How about just try once or twice each day? Because if you do even a little bit each day, that's better than none, and it's tolerable. So you have to find what's in their tolerance level. So lack of compliance is is our number one downfall. So we have to make
Sure.
sure to prescribe something that the child will comply with.
Well, tell the audience the power behind making sure that child can skip. And just to let you know, that one little person from here that you gave that exercise to, he's mastered it.
Because he has a mother that's
Absolutely.
yeah.
And we're like that here too. We have to be the ones that shape and guide.
Mhm.
But what's the power behind skipping?
Well, that's reciprocal intuition. You have to use one half of your body and the other half of your body in sync with each other. So when I talked about the decision, the thinking brain, it actually is split into two parts. There's one part that has habits, habitual movements, and there's another part that's actually making new decisions and really thinking. And as you know from the QEEGs, you can see the activity, whether it's in the heavy duty thinking part or not. So for skipping, at the beginning, it's new. So you have to make a decision of, okay, right side, you're going to hop. And left side, you're then going to move. And then the left side, now you're going to hop. And the right side move. So there's a signal going from one side of the brain to the other, back and forth, back and forth. And it has to go in a good rhythm. So you're coordinating the right side of the body with the left side of the body, the right side of the brain with the left side of the brain. and it's hard because you have to use your peripheral eyesight to judge where the floor is, especially if you're going to skip over a puddle or over something. So you're using your sense of balance and your sense of peripheral eyesight, as well as the sensors on your feet, the sensors in your neck. Because if you've ever tried to skip with your head tilted, it's much harder. Because
Right.
so it's when children master that, and then later master jump rope, which is a judgment in time, then everything's different. I mean, I've had so many students that make breakthroughs in their learning when they've mastered jump rope.
Yeah, I was just talking to some parents this morning and looking back at this developmental journey and then looking at his map, and he's 11. And I'm like, we can definitely do neurofeedback, but I like to also caution people it's not a magic wand.
Yeah,
We have to look at the whole person. And if there's things that they missed, we have to go back and get them
yeah,
because you just can't bring the brain where it needs to be. And I'm hearing just like he has no motivation. And he's been like this ever since he was really little.
hmm,
And he's got enough in there showing how many interruptions have actually happened. And you do, your heart breaks and you go,
yeah,
they're 11. They've only been here 11 years and they're already ready to kind of push back on everything.
yeah,
So that movement piece, I'm seeing areas in his parietal lobe, which is like right there where the sensory motor cortex is. And on his map, it's showing parietal lobe deficit. And we got to move. We got to get
hmm,
our kids moving. So, well, this has just been wonderful. So, thank you so much for carving out this time.
hmm,
So, give everybody again the name of your practice,
hmm.
your contact phone number, because people, they start calling. And I heard you on Dr. Hanson's Connect My Brain podcast, and I'd like some more information. How do they find you?
Well, it's easy. Our phone number is 2020, so it's which is really hard to remember, and it's the beginning is May Day, which is May 1st. So it's 501 2020, and
That's right.
our area code is 847. So it's 847 501 2020, and we're at mindeye.com, and you can write an email to info@mindeye.com to talk to an advocate.
And I just want the audience to know I have searched. I have searched North Carolina. I have searched Georgia. I have searched Alabama. And I only like to recommend the best. And I have been by this person, Dr. Zelinsky. I go to her. My daughter goes to her. And so many of our little cherubs here at Connect My Brain go to her. You have to see that how much change has actually happened in the lives of these children and even myself and my daughter. It's really worth the travel. So please check it out, mindeye.com. And if you have any questions, you can always reach back out to me at connectmybrain.com. If you didn't have a chance to write down the number or whatever, feel free to send me a message and I will help connect you to the Mind Eye Institute. Dr. Zelinsky, thank you so much for joining us today.
Thank you, Laura. It's a gratifying profession, as you get. Also, it's fun to help people every day. We start our day at the Mind Eye Institute with how many people's lives are we going to change today, and it's
Yes, absolutely. Well, you're doing it, so feel confident and be excited, and then we'll see you around the next time.
okay.
Okay?
All right.
All right.
Bye.
Bye.